Safely reopening schools is one of the new administration's top priorities in its first 100 days. As part of his $1.9 trillion COVID relief plan, the president is looking to get schools the resources that they need to get students and teachers back in the classroom. So I want to bring in Dr. Dyan Hes. She is the founder of Gramercy Pediatrics. Doctor, we have talked throughout this whole pandemic about how much you want to see kids back in the classroom. You think that is good for their overall health, the pandemic and everything else that keeps kids healthy and happy. President Biden is pushing for more funding for these schools to reopen, and he talked about what he wants to see at a briefing yesterday. I want to play a little bit of what the president had to say.
We need new ventilation systems in those schools. We need testing for people coming in and out of the classes. We need testing for teachers as well as students. And we need the capacity to know that, in fact, the circumstance in the school is safe and secure for everyone.
Okay, so you heard a few of the things that the president said are essential to get schools back open across the country. Do you agree? What would be sort of your top priority if you were advising the president?
My top priority would be to get kids in school, not just 2 days a week, but 5 days a week. I mean, the kids who are home have to go back to school. I had a little boy yesterday in my practice who was 6, who's literally, when he's stressed, he says to us, he hasn't been in school a whole year. He's in a charter school that hasn't opened in Brooklyn. And he's been playing so many video games that he's almost become like merged with the video game. And he said to his parents when he's stressed, he's like, I'm melting. I feel like I'm melting. And they're like, what do you mean? And he expressed that it was actually from like a Spider-Man game that he was playing. And he just hasn't seen kids. He's only seen like his 2 cousins that are in his pod since, March. These kids need to be back in school. The parents don't even have an option to send them if they want. So we need these kids back in school. We need frequent testing. If we do testing weekly, we will pick up those asymptomatic cases that haven't gone to their doctors to be tested, and we will remove them from the setting, and they will have their masks on so they won't be spreading the disease anyway. Masks work. We're not seeing these massive outbreaks in all the schools that are open where they're wearing masks. And I've said that I'm like a broken record at this point.
So, Doctor, the New York Times is reporting that a school district in Nevada is working to get students back in the classroom after 18 students committed suicide or took their own lives, rather, since school closed in March. That is double the amount than the year before. Can you talk about the mental health impact that these shutdowns and the isolation are having on children and teens, and what can be done about it?
Well, this is just like what we've been saying. These kids are social creatures, just like adults, but we get to go to work if we choose. We get to leave our house if we choose. If their parents are scared that they're going to get COVID or they have a sick family member and their schools are closed, they're on lockdown. They are not going anywhere. And they are, we talked about this before, the influence of social media. It always looks like somebody's having a better life than you are, or they feel hopeless, or they wanted to apply to college, but now financial reasons they can't go. I mean, there are so many factors. If you were planning on going to college and needed financial aid, but now your parents are out of work and you can't really fill out the financial aid forms. I mean, there are so many factors affecting these kids, and they go on social media and it looks like a lot of people are having a lot of better life than you are. It is very, very isolating and making you feel like you have little self-worth. And there's also very little mental health resources. I can tell you in New York City, if you have to go through the insurance program, the chances you're going to get a counselor, it might be in 3 to 6 months without COVID. So can you imagine now with COVID how many people are in crisis and you're not meeting your school counselor, your guidance counselor, the school psychologist? The subtle signs of depression are not getting picked up by teachers or pediatricians or nurses, school nurses. It's just a tragedy all around. And we, like I keep on saying, we need the kids back in school.
There's a study out of the University of Florida. It found that children are almost 60% more likely than adults to spread COVID-19. They studied how the virus infected 27,000 households in Wuhan, China. And the researchers say that the results underscore the need to start clinical trials to test the vaccine on children. Why would children be more likely to spread the disease? And how important is it, in your medical opinion, rather, for children to be enrolled in vaccine trials?
So you have to remember that in Wuhan, China, most families live in a 1-room apartment. So there is extreme crowding. They might be lucky if they have 2 rooms and they're all sharing 1 bathroom, and that's their whole apartment. And that's usually with multi-generation, with grandparents, with parents, and with children. So it's very different in America, because if we test that a child's positive, in most cases, we can isolate that child. They can wear a mask, the parents can wear a mask, and we can try to minimize the spread in the household. Wuhan, China is a totally different animal. It's very crowded. You're living with many elderly people. And I think when those studies were done, people weren't masking at home. Now we know if you're positive, then you wear a mask and you isolate. You know, sometimes a mother will isolate with the child or the father, and somebody else will take care of the children who are healthy. So there are ways to mitigate the spread in the household. I'm not saying it's 100%, but we can mitigate it. And yes, we do need children in the trials. We have to open the trials to younger children. And I think I told you this last time. I tried to enroll my children in any study, and there's no study around New York City that I could even enroll them in. So the trials are limited, and you have to realize that there's a lot of rigorous science behind studies. So you just don't open a study in a day. If you want to open a study, you have to have parameters. You have to have the teams on board. You have to have multiple hospital sites involved. So it takes time. And yes, we will get down to the younger children. But right now, if we vaccinate the elderly and the adults and the high-risk essential workers, we are going to be able to let the children go back to school and open up our country a bit.
California Governor Gavin Newsom lifted the state's stay-at-home order yesterday, allowing restaurants and churches to start offering outdoor services and some other businesses like salons to reopen. What's your take on this move while the virus is still so widespread there?
I think it's a good move. I don't think extreme shutdowns are beneficial to anybody, because what we see is after an extreme shutdown, people kind of go crazy and there's a huge surge again. So, and that's what studies show. So instead of having like a wave like that, you're just having a flat line because nobody's out of their house, and then all of a sudden it peaks. So you get the same number of cases in the end in just a different amount of time. So I do think that the economy needs to be open. Like we were talking about, just like children are depressed, adults are depressed, they can't pay their bills. It's like it has a domino effect. If your parents are depressed and out of work, your children are going to be depressed. Outdoor dining is relatively safe. We've shown the economy needs to be open. People need to be able to go feel a little bit of freedom as long as they wear masks. And I think now that we're going to have a mask mandate, it's going to change everything. I think if people are not wearing masks, yes, we're going to see. I posted on my Instagram the other day that there was like this wrestling match where, 4 people in the audience out of maybe a couple hundred were wearing masks, and it was a huge super spreader event. That's not a surprise. You have crowded people in a gym. But if you enforce masks and limit capacity at restaurants, you can get back to some sense of normalcy in all walks of life.
Which is what everybody's hoping for. Dr. Dyan Hes, as always, we thank you. Appreciate it.
Thank you. Have a great week.
You too. If you feel that yourself or anyone you know may be struggling during this time, please call 1-800-273-TALK to speak with someone at the National Suicide Prevention